to understand what your costs will be year 2. And you'll kind of already be prepared to budget for that. We also have the only refresh on the benefit renewal report are the addition of the voluntary dental and vision rates, which as I outlined was really almost no change. The dental went up just slightly, a few percent, and the vision actually improved just a little bit.
What page is that on?
So let's see, the dental benefit starts on page 15. And the modified rate is on page 16. And I put a little highlight on voluntary there. It's the last column. And then the vision updates are on page 17 and 18. And again, just a little highlight on those. Those are the 2 different networks, which we already discussed which network we would go with, but. Yeah. On dental, it's an exact rate mirror of your current dental plan. And then vision, of course, is not because you only have the exam right now. And the last piece we have is that contribution modeling worksheet that we sent over. I'm sure that's probably where most of the questions will come up, but.
This page, correct?
Yep.
All right.
The first page of the contribution modeling worksheet is, again, your current costs. So we have your fully insured medical premiums, your fully insured dental premiums, which are currently combined with your medical, and the vision premiums as well. The second page being, we did model out that maximum claims amount in the premium equivalents. So that's what you'll see in the contributions page. There's 2 different ways to play with it. You can either adjust the contributions themselves, or you can adjust the percentage of the premium that the employee is paying.
You're saying premium, so this is to be paid up front by the employer or monthly?
So these are the monthly premium equivalents, yep.
It's a premium equivalent. In other words, you're saying this is total all-in cost.
Yes, and with the
Yeah.
maximum claims, again, that's the most you
With the
could pay.
maximum claim.
Yep,
Yeah. Not a premium equivalent.
exactly. The amount that's over what you actually spend is retained by DeKalb.
So the reason it's premium equivalent, right, it's because you get to set what the premium is. We're recommending to the max. You can do it to the expected claims amount, but it's a premium equivalent because you get to set them as opposed to the carrier getting to set them. And then in addition to those premiums or out of those premium equivalents, you pay the claims.
What happened to our original request that this all be done by copay with no upfront premium? We had that request in, and that was talked about a lot.
So are you meaning on the plan design for the employee? So that didn't change. That's the same, that is the same that we discussed at the last meeting. So this is just all back-end type things. This is all your guys' information. The employees may know what the premium equivalent is if you wish to share that with them. But I mean, this is really your own costs and how you're handling the budget.
How you are funding it,
Yes.
correct? So yes, you can take all of that premium or premium equivalent and you fund it, but this just tells you how you fund it, right?
Okay.
So you can fund all of it, or you can share that funding with the employee. So it's still the same thing we talked about. But this is showing you how to fund it.
And if you look at that larger stapled sheet, page 13, the far right is the actual plan design that your employees will see that we discussed last week. So they still have no deductible, co-pays based on cost and quality.
we go over the co-pays real quick?
Yeah, absolutely.
How do the co-pays work out looking at this? What's the percentage?
So if you're looking at the office visit, for example, the $15 to $100, the employee would research on the Surest website to understand what that cost is going to be before they go to their primary care physician. And that is based on the cost and the quality of the provider. So that's all kind of determined on the back end.
But that's a flat fee.
Yes, the most they'll pay for a primary care visit is $100. For
That's all.
urgent care, there is a flat 50.
Okay, so what is the actual percentage then? In other words, I'm reading office visit, PCP, in, out. Go to this Surest, proposed number 2 there,
Yep.
15 to 100, that doesn't tell me anything. What is that telling me, 15 to 100?
So that is telling you what the copay would be. And they would have to do that research to understand which primary care providers would be the 15 and which would be the 100.
You got to go away from the term copay, but that's in essence of what it is. So if you remember going back to when you were meeting with all of the different brokers, right? And we pulled up the app and we said, okay, so your members can pull up the app, do it online, they can go to the website, right? And it says, okay, I'm going to have a baby. So that baby is either $900, somewhere between $900 and $1,700. And they choose, that's their portion of the out-of-pocket max, so to speak, right, for that particular thing. They're going to pay $900, the county's going to pay the rest, the other part of that. We don't know what the other part of that is. We just know, and the employee knows what their part is, but you're paying the rest of it. So when you go to a doctor's, when they have a doctor's office visit, they get to look ahead of time. This is going to cost me, primary care, $15 to $100 is going to be my range. If, as the employee, I get to figure out, okay, do I as an employee or a member want to pay $15, $45, whatever the case may be as I look on the app, up to $100 in network. And they get to decide ahead of time, do I want to use the higher valued one? Does that make sense?
Like if I had, I have my doctor, and there are lots of our employees that have their PCP, not interested in going anywhere else. Okay, how much does Mark Souter charge for an established office, patient office visit? It's like $175 for whatever that is. Now, normally, the way that we've done it before is whatever Anthem had negotiated with him, if because I'm on the HSA, okay, that'll be $75. So I have to pay $75. That is my copay from there. Now, if you're on the PPO, you knew that your copay was going to be $30. You walk into that office, it's going to be $30. So employees would probably know up front if they're going to have a $15 copay at their particular PCP or if it's going to be a $100 copay.
Let me back up the question. So we know what the employee knows their cost. What's the cost to the county for the employee's decision? In other words, let's say they opt for the $100 visit. Does that mean that our expense goes up by that multiple also? In other words, let's say they select a procedure that's $1,000 and they got to pay $100. Do we pay the other $900? Or if they would have selected the 15, would we have paid $200? You see what I'm saying? Does their selection increase our expense also?
It could, but it doesn't necessarily. So with this, you're using the United Healthcare Choice Network or whatever it is, United Healthcare Network. United Healthcare has pre-negotiated all of that ahead of time with these different care providers. So they're going to pay this much or X amount for this procedure, right? So you don't exactly know what that is, but the copay, I won't say copay, the payment differential that the member pays is based on value, quality of care, and pricing. So if they go to a higher cost facility and they're paying a little bit more, and you're going to pay a little bit more, right? We don't know we know what theirs is, we don't know what yours is.
So we're essentially trying to incentivize them to go to the lower cost, lower quality, which would benefit both parties.
That's what I'm trying to get
Yes.
at as far as.
And how are the physicians or the facilities rated by what, entity up above?
So sometimes the cost can be the same. The overall cost, the county's cost can be the same. But when they take into consideration the quality of care, they're looking at how many times are there complications with that knee surgery, that shoulder surgery, that whatever surgery where it's more costly because they keep having to come back, or there's sepsis, or there's infections, or there's something. So they look at the quality of care, and if they pick the higher valued one, there's less chance that there are going to be complications or that they're going to have to come back. So there's transparency for the member, but there's not as much transparency for you. That makes sense? We don't know, because when you have a baby, right? The higher quality doctor, everything having to do with that baby is bundled. And I don't know why I always come back to the baby example, but everything is bundled. But you're going to pay, according to each of those DRG codes, you're going to pay for everything there is. The member is just capped at that 900 or whatever that amount is for pregnancy or for a baby. I don't know if I'm digging a deeper hole or if you're making sense.
Yeah. The cost and quality metrics are being evaluated based on clinical outcomes, and utilizing the United Healthcare Network, they have access to so many outcome information, quality information, of course pricing, because they're utilizing all their history of pricing. So they're making these decisions based on informed clinical outcomes.
Does the total estimated premium equivalent include the money that would be taken out by the copay? In other words, does that include the copay amounts? In other words, let's say we have $3 million in medical claims. Then is the copay figured into that as being a deduction? In other words, $3 million worth of claims, but they paid, $700,000 in copays. Is it really $2.3 million then, cost to the county?
So they are evaluating the plan design a little bit. But most of all, they're looking at the maximum cost of claims overall.
Overall.
Yeah. So a small change to, your plan design wouldn't really impact the information that we have. They're looking at the maximum overall claims.
So
Might make a small change.
Answer your
but-
question, yes.
Yes.
So the overall claims amount, and then there's the member's portion, and then there's the county's portion. So that claims amount is the overall claims amount, yes.
Okay. And again, and maybe I don't understand how they come up with the 15 to 100 on the office visit, but are there really, I'm just looking at a 1-to-1 ratio comparison between the copay and the total bill. Are some doctors actually 5 times more money to go see for an office visit? So I can't imagine,
So office visits, probably not. Okay. So looking at that, especially with the United Healthcare negotiated rates, probably not. A surgery, absolutely could be. Yeah, absolutely.
All right.
Or an image or a blood panel. Yeah.
Yes. So, as I understand it, there may be like a couple of different. It's a complicated interaction between the lower cost of the employee payment, like $15, versus the higher cost of $100. The $100 doctor may be the lowest quality.
Exactly. Yeah. They may be the same cost with low quality.
So it's a complicated interplay. It doesn't necessarily mean the $15 doctor is the worst doctor. It may be the best doctor with the best outcomes and the overall lowest cost.
Yeah. Absolutely.
But the highest it might be the highest, cost for that doctor's appointment, but the best outcome in if that makes sense.
A complication can be very expensive, so that's like where quality plays in.
To somewhat make light of the difference in a $15 versus a $100, when you walk in the door with the $100 doctor, that doctor may say, "Oh, congratulations, you're my first patient." You know what I mean? So, or this is my first knee surgery. So, I don't know how they come up with that range.
Does this apply to all of, what do I want to say, like MRIs, X-rays? It applies to all of that.
Yep.
They
Surgeries.
They negotiate all those prices just like Anthem does.
Yeah. And don't forget, preventive care is still covered in full. So if your employee goes in for their annual physical, their colonoscopy, those are still covered at 100%. So this is really saying, I have an issue, I'm sick, I need to go to the doctor. So this isn't just, every single interaction they have with the provider. They still have that preventive care that's covered at 100%.
Why can't we just do a percentage of what the doctor charges instead of 15 to, like on drugs, $10, $60, $90? It's a flat amount. Why not a percentage up to the maximum total out of pocket?
That's what he had originally
Well, okay, so
asked for.
that's a good question, and this whole thing is new. So there are other options where, I mean, people can set this up so that you're doing that, but what's the incentive then? So if you just say, okay, a pregnancy, again with the pregnancy, but a baby it's probably going to be around $5,000. Our average is going to be around $5,000. Okay, you can go to a good doctor, bad doctor, good hospital, bad hospital, expensive hospital, inexpensive hospital, and it doesn't matter. So the way that the Surest and United Healthcare have set this up, they are trying to incentivize making good value decisions.
Yeah, and quality. I mean, let's say that your procedure is $5,000 and another procedure is $3,000. The employee is most likely going to choose the $3,000 if they're paying a percentage, but that gives them no information on the quality of the provider who they're going to. If they're just going to the least expensive, then let's say that doctor is low quality and then that person is readmitted for a complication. Well, then their cost and your cost has suddenly massively increased. So just based on cost is sometimes complicated in the medical industry.
But we just discussed that the most expensive doctor may not be the best doctor and the cheapest doctor may not.
That's exactly
So-
true. That's why we won't say copays, but that's why these dollar amounts are based on cost and quality, not just quality or not just cost.
So they've decided who the good doctors are and the bad doctors and adjusted the copay.
We won't say good and bad, we'll say statistically, the lowest complications, the best outcomes.
Interesting.
So
Yeah,
then you give those doctors the lower premiums, or
Yes.
they do, so then it incentivizes your employees to go to the best overall doctor.
Exactly, yeah,
Okay, so it's a combined matrix of
Yes.
how they come up with
exactly. Doing one or only the other isn't the most effective.
I see you have a flat 500 copay on emergency room.
Yeah.
So whether the bill's 500 or 5,000, it's just a flat 500, right?
Yeah, that dollar amount is high enough to incentivize employees to not go for a non-emergent reason, but
agree.
reasonable enough that if they do need to go.
And if you look at the urgent care under that, it's 150. So I can go to
Just 50.
or I'm sorry,
Yeah.
50. If I have to make a decision where I go, do I think it's an emergency? Maybe it's not an emergency. I'm going to try to get to the urgent care and cost me 50. And obviously that's going to save the county money too, going to the urgent care rather than the emergency room. So then they disincentivize going to the emergency room at 500. Question. You had a question?
Yeah, I mean, not about a comment, what if that emergency room is 3,000?
I mean, when you
Then we
have
go
a
backwards
true
on it.
medical emergency, that's when we say that's what insurance is for. You need to get to where you need to get to, and that cost at that point, not that it's a moot point, because it is very important, but at the same time, if they're having a true emergency, we need them to get the care that they need.
Finger sliced off.
Yes, exactly. And under your fully insured plan, These employees were making all these decisions just like before. They just had no incentive to go to that higher quality, lower cost doctor. And you're seeing in your premiums the kickback of that.
And again, what was attractive about this is emergency room, $500, right? So normally, if they had an HSA plan, the employee is maxing out their HSA or their deductible before, just with one event. And then after that, it doesn't matter if they have shoulder surgery at the most expensive or least. It doesn't matter if they go get the most expensive lab, because they are no longer incentivized. This plan, and the reason we chose this plan is because you're incentivized through 3 or 4 what would be very costly events to keep making the best choices.
The only thing I don't like about the hybrid plan, as I call it, mixing the, low quality, it's not used the term low quality doctor, high quality, but you know what I'm saying.
Yes.
They've done that. They've said by giving this cheaper price, we feel as this person has less comebacks. Your doctor, who you feel is though maybe high quality for you, but maybe they're low quality for other people, you may have to pay more to go to your doctor because this company said that this person's low quality. So I always thought it'd be better just to do 30% across the board, whatever the bill is, you pay the first 30 up to your total. I don't care where you go. You want to select the low quality doctor?
Well, they
Go
still
ahead.
have the opportunity to select whoever they want,
Yeah,
right?
right, but the
Yeah.
copay doesn't align with that is what I'm saying, is they,
Because we're trying to give them the information to
Right.
make the best decision, but we're also giving them the option to make whatever decision they want. In some plans, you can say, you have to go see, you have to go to this hospital or it's not covered. You have to
Right.
go to this or it's not covered. So you're still giving your employees the option to go to where they would like to. They're just making they're able to make that decision rather than it being made for them.
And I also think we're giving less, putting less weight toward the cost of care than, I think we're talking about the quality of care, which is probably, there's less variable there than there is the cost of care, because there's such a wide range of cost, especially in this area. A wide range of costs that I think a lot of this is weighted toward the cost. And I go back to if you have lab work done, right? The machine is the machine. The pictures are the pictures, or the imaging or whatever, complex imaging even. If you go to a standalone facility, it's whatever it is, $50. If you go to another one, it's to a hospital and it's $500. So you're going back, well, let them go where they want to go. Well, this way you are incentivizing them to go to same procedure. It's not quality, maybe quality of the picture, I don't know, but it's $50 versus $500. Why wouldn't you incentivize them to go to the $50 one?
well, a flat percentage is an incentive to me. I mean, if I go somewhere and I say how much it is, and they say 3,000, 30% of 3,000 is 900. If they say it's 1,000, 30% is 300. To me, that's incentivizing right there. A simple percentage to me is easier than letting them decide who the best doctors are. But
Okay, so I have a question. What if no employee does any research whatsoever, they continue on as what they're wanting to do? What is that actually going to do to our costs?
They won't change. I mean, if you're saying if they continue on the care path that they're on with their current providers,
They don't do the research, they don't worry about incentive, they don't do anything like that.
So if we're talking Anthem to United Healthcare Network, let's be completely honest, not a huge difference. So there won't be a huge difference in that situation for your guys' costs.
Yeah. So you're saying if they don't pay any attention to the quality of care and they just go wherever they want.
Or they're not paying attention to the cost of care.
Right.
So they're already at a certain higher cost of doctor.
Sure.
Kind of like they're doing now.
Yeah.
Kind of like they're doing now.
Yeah.
Why wouldn't you make an effort to make that less costly?
Yeah, we can
Because the-
educate. All we want.
The cost to us will continue to track upward, just like if you renewed a fully funded Anthem policy. If you
Why-
continue the same habits, that spike or that upward trend is going to keep going because the costs continue to.
I think a lot of that comes down to education as well in the employee meetings is we are trying as a group, right, to collectively contain the costs. So we need to express to, your employees what we're trying to do and why. Every year you could continue to see increases unless we as a collective group actively work on bringing the costs down, especially when you get into self-funding. I mean, this is truly your dollars for each claim going out or staying in. Before, it was only costs going out. There was no opportunity to reclaim the,
And that's
the
been,
savings.
that's been the key tenet of this
Yes.
whole conversation.
Absolutely.
From the very beginning, is
Right.
it's got to be education
Mm-hmm.
and a real effort to incentivize healthy lifestyles,
Absolutely.
healthy medical habits, and again, things like the availability of the clinic and.
which is
and
how
those
this
kind of
plan
things.
design was born, if I recall correctly, from what I've heard.
So Todd,
That was the absolute first thing that came
Yes.
out of any of this conversation about going self-insured.
Right.
let's go back to, and again, having a baby. You're going to pay, if you are going strictly by employee pays 30%, county pays 70%, they don't know up front what their cost is. So they don't know if they're making a good decision, a bad decision. You can't say all in having a baby or all in shoulder surgery, what those costs are going to be. So it's 30% of some unknown number up to their out-of-pocket max. We don't know what that is. The member doesn't know what that is until all the little parts of that procedure are done. It's over. Okay, 30%. Whoa, you know what I mean?
Right. With the surest, they can get in and see what their costs will be up front. With the hospital, as Bill's saying, they get their surprise bill in the back end, because you can't call Parkview and say, hi, I'm coming in to have a baby.
Right.
Could you tell me what 30% of that cost is going to be? They're going to say, we have no idea what is going to happen.
Yeah, I'm in the wrong business. I need to be able to sell you a car and just say, well, bring your checkbook. I'll tell you how much to
I'll
fill
charge
that
you
in for.
30%. Yeah, exactly. Exactly.
I've got a question.
Transparent pricing is a huge issue in the industry, and we're trying to combat it, but
I got a question.
yeah.
Do we know, under this plan, on average, per year, what is the employee contribution going to be? Is there a number? Can we put a number on that?
So
compared to what
that
the
is getting
counties-
into that contribution modeling worksheet that I sent over. We have a couple of different ways that you can play with it.
No, stop one second. Are you talking them contribution out of their paycheck or contribution in copay?
In copay.
Oh, okay.
You
Got it.
Contribution is
No.
not copay.
Yeah, that-
Okay,
this is with
the
no-
amount that they're paying
This is no
towards-
premium out of their check.
Right.
This is just strictly copay.
So the reason that we don't know that is we don't know what services that your employees will need to render throughout the year.
Based on past average, though, what? Can
Well,
you
we know
base
it-
on history? of
We
what-
know what their out-of-pocket maximum will be with this plan. $5,000 for a single, $10,000 for a family.
That's maximum.
Yeah.
That's maximum.
And it's embedded, meaning
What
no
is their
one person.
percentage compared to what our percentage is out of this plan, the way you've got it structured?
Unknowable.
Unknowable.
Unknowable, except for when you go to, your all-in maximum liability, is this the number here, 3?
Max, yep.
What page is that?
It's on the premium equivalent page.
Tan.
Oh, I'm sorry.
No, you're fine, the tan highlight sheet.
So your all-in maximum liability for the claims is $3,026,000 plus the admin and the stop loss. So I'd have to go back to
Oh,
that
that's
page.
Cobra. So 2.967.
Yeah, 2.9,
Yeah.
okay. For the
For the whole package?
Yes.
Yeah. That's the only piece that we can say for certain. The county will not exceed $3 million. We can say that for certain.
at your current enrollment, yeah.
Right. Thank you.
So, does that make sense?
And what's our current outlay last year? What did we spend last year? Or then this year, I guess you would call it?
Yep. So your last year all-in cost was 2.186 million. Your renewal this year, if you were to take the Anthem renewal, is 3.054. That was that 40% increase.
So the renewal amount is the same as what our maximum out-of-pocket?
It's higher by,
Close.
Yeah, about the same.
about 100,000, a little less, 80,000.
Yeah. But that's 125% of,
Correct. That is, yes, the maximum cost, 125% of what they expect claims to be.
So there should, if anything, we should be banking quite a bit of money at that amount for future.
Correct.
And then we can
That is
make
the
plan
hope.
modifications as needed, correct?
Right, that's the idea.
Yep.
That's now, again, that's a pretty substantial increase at the maximum all-in cost, right? We all
Right.
see that. So, and our actuarial team says we recommend funding it at the max.
Sure.
If you don't have to do that if you don't want to, if you can fund it to the midpoint, you can fund it to the midpoint, and if you look at the first column on that kind of tan colored sheet, yes. Instead of that 2.967 million, you can fund it to the 2.724 million, knowing that at the end of the year, in the worst case scenario, you may have to find $200,000 from some other source to put in there, right? So the chances of you hitting the all-in 2.9 million are
Extremely slim. Yeah.
extremely slim. And I would say
I
that
think it's safer to start out
it's the most
there
safe, yes.
and have a surplus
I'd
at
agree
the end
with
of
that.
the year,
Yeah, absolutely.
and then make the adjustments, because this first year is going to be,
A lower cost. Yeah.
yeah,
And next year, the cost will be based on 12 months instead of 10
Yes.
months.
right.
But we and stop-loss carriers will have a much better, clearer picture of what your claims throughout that
Which
year
might-
on this plan.
Right.
Might reduce it a little bit if it's good
reduce it.
claims and we have a good history.
Might
Yeah.
reduce it, might not.
And it gives us more information. And I know that Bill's talked to your team about our pharmacy team and all the things that they can do to save money on the pharmacy side. We'll have all that claims information in-house so our pharmacists can make a recommendation on pharmacy savings. I mean, getting to that starting point gives us the information we need to really take off.
And right now, time being what it is and lack a little bit of claims data up until recently, even on the pharmacy side, we said, take the $118,000 worth of rebate credit and give us a year to look to see if your actual rebates, or if there are things we can do with on the pharmacy side in the year to come.
now, are we still talking about a 50% reduction in the upfront premiums paid by the employees?
That's completely up to you. These are maximum all-in costs. So then any amount that you collect from your employees would offset that.
We can do that any way you want to.
Yeah.
Bill.
Yeah. We could pay all 3 million, or we could tell the employees they gotta give us 500,000 and offset it by
Yeah.
that, whatever.
So the top amount that is in this contribution modeling worksheet is based on your PPO plan contributions. And that bottom box shows your HSA contributions. So you can mix and match that any way you
Are you
want.
on this page
Yes.
Yeah.
Thank you, sorry.
So conceivably, I mean, we could give very similar coverage, as good as, if not better,
Yeah.
coverage than we have now.
Right.
Reduce the employee contributions by 50%. And that's a great deal for them. We look at it again in 12 months. If we do what we're supposed to do in terms of wellness programs and all, being able to incentivize some changes there, at the end of that 12 months, we should have a surplus and be able
Right.
to look at the employee contribution model again.
Definitely. So for the employees who are on the HSA plan, 84 of your, 200, they're going to pay less each time they visit the providers. There's no question, because right now they're paying 100%. Now, the people on the PPO plan are probably going to pay a little more than they're used to. But as you're saying, they'll be able to reduce the contributions, so they'll still probably, be able to come out ahead on that.
And of course, by the same token, you can go to no employee contributions and do it strictly on copay with a higher copay. I mean, that's the beauty of this exercise,
Right.
is being able to design this plan the way we want to.
Well,
I mean, within the
well,
reasonable parameters.
but what I'm reading here is we don't control the copay. We can't adjust that. They've already set the copay amounts in their,
So the range can be adjusted by DeKalb.
Oh, yeah,
okay, I didn't
yeah.
know that.
This is just a,
The
this
range
is
of
just a
the
model.
amount the employee pays.
Like $15 to 100, the
Range
county
of the
can
copay
change.
can't be. All you can control with this is the premium equivalents and the employee contribution amounts. You can't change the copay.
Right.
Okay.
That's, that, okay, so here's what I've only done this for a little over 2 years now, but what I've heard every year, we can't get good employees because our insurance is too expensive and we don't pay enough and, you know, their net check is too low. And I get that. And I think that, Dottie, you would agree, right? Because what do they look at? They look at the bottom of that paycheck.
They look at the bottom line on their paycheck.
So let's back up of what we've done and see if we're doing the right thing here, because to me, I think a huge employee benefit when you go to hire someone is your insurance costs you nothing. Currently, I'm getting almost $6,000 taken out of my check for my insurance, which is fine. I'm happy to pay it. But I would be, if this was my primary job, I'd be much more apt to take the job if you said, we're throwing all that, you're taking nothing out. Your money, I'm money ahead by $6,000 for some employees here. That's a 15% raise, if you really think about it. And then they decide how much they spend after that.
There's the incentive,
That's the incentive.
for being healthy.
I've already got my money and I don't want to give it away, so I'm going to do the healthy things. I'm going to, so here's the other thing that I hear about is we need to nail this down because we got to make sure we get all the deductions out correctly and this and that, and it takes time. And again, the more we deduct out of their check, the bigger that net number is. Here we are upselling our employees AD&D and other life insurances and everything else, and we sign them up for all that stuff, and some of it they may not even need, and they look at that net check and go, man, I'm not making anything. Well, it's counterproductive for us to sell insurance policies through the county. I don't like it, and I know everyone thinks this is a great benefit, but I think you have a better benefit to have a relationship with a local agent somewhere that you can go to for your AD&D and any other insurances you want, and keep it out of the paycheck, because again, that net amount is what they're looking at.
Except I don't believe that you can buy it individually for what the group rates are.
Yeah, a group rate is going, unless you're
Especially-
19 years old.
Especially the life
and-
insurance
I
part.
don't
Yeah.
agree with that.
Okay.
I know someone in insurance says I'd love to quote it, but, you know, I'd have to see what the actual numbers are, because
Well, I can tell you, I'm a licensed agent.
That's what I'm saying.
And I can tell you that the group rates are considerably less expensive.
maybe it matters what group you're in.
Not to mention, any type of condition that you may potentially have would completely eliminate you from buying an individual policy.
Oh, I agree.
Yeah.
But the thing is, we're not here to guarantee everyone's life.
Sure.
And we're here to give good medical coverage that they can afford.
Yes, let's get back on track for the
Yeah.
medical coverage
Well, no, what I'm
first. Yeah.
saying is,
Yeah.
though, what I'm saying is this all ties together because I want to give good insurance at no cost to our employees and get rid of the smoke and mirrors. The next one, and I don't mean to go off on tangent here, but this does play into it.
Fine.
Dental insurance. My wife works for a dentist. He got rid of Delta Dental, period. He says, I can't deal with them. Listen to this deal. He charges $1,500 for a crown. They give him $610. One of the reasons they give him $610, he's an established dentist that's been on the program a long time. They penalize him for that. New dentists that sign up, they give him a better compensation rate. Plus, he's not in a blighted area, so they pay him less, believe it or not. And I didn't believe him. He showed me the letter.
Yeah.
And he says, I just quit taking it. He does that crown that he charges $1,500 for on cash. He'll do it for $1,000. You got to ask. So really, you get a better deal without dental insurance because it's capped at $1,500 anywhere. Mine was. Maybe it was even $1,200. I can't remember. It was a
Not much.
No, 15.
yeah. So it's not insurance. It's a limited benefit maintenance policy is what it is.
Which I think that y'all's plan of pulling dental out of the mandatory coverage and making it voluntary is smart because the employees were paying for it. in it before, whether they wanted it or not,
And
as
only
you were.
50% or less are
Right.
using it too. And
So some people
yeah.
do view dental as a benefit, especially for budgeting purposes, right? If you know you're gonna have, X number, a $2,000 crown, not everyone has $2,000 to shell that out. Now with the dental coverage, it kind of helps just budget that for them. So it's pulling it out as voluntary then allows them to choose or not choose
Right.
the benefit.
the other benefit it gives them, though, not to be in the program, they can go to the dentist they want to go to and work their
Right.
own better deal. And again, have that personal relationship with the doctor. They can work a better deal. It's the same with eyeglasses. I went and used our insurance for my exam. They paid for my exam. They got compensated $42 for it out of the $69 they charged. And I asked the lady there, I said, if I would give you $42, would you accept it? And she said, oh yeah, we'll take the same amount insurance pays, but you got to pre-negotiate it with us. And I got that. And then the glasses with the discount would have been $375 there because we get a discount through Anthem, I guess. They don't pay for anything, but suppose you get a
Right.
discount. Well, with the discount, it was $375. Bought the same glasses through iBuy.com for $135. So I don't see any benefit whatsoever to the vision or the dental from a cost savings benefit for the employee or to the county. I think it's just money pissed away. That's my opinion.
I agree with you on that argument, on those two, but what I was talking about was like life and.
Yeah, I got it.
and
I got it.
disability and so forth.
Oh, no, I get you. I'm just saying the
Yeah.
more that you pull out of their check, the more they look at it and say, I need a raise. And so I don't think the average person really understands the benefit of that insurance. You know what I'm saying? It's like, well, yeah, I have it, but man, it costs a lot. I want you to pay for that now. You know where I'm going with this? But anyway, here nor there. So the only other thing I love the idea of the clinic. And this does play in, and I know it doesn't directly affect you, but the 11 hours a week, it's not even close enough. So those numbers that we were given, and I appreciate those numbers, I don't think they're valid because we're going to have to go to 25 or 30 hours a week if we're going to more than double the amount of people using that clinic.
No, we're not.
You don't think so?
No, they have 700. We only have 3.
Yeah, well, that's true.
Yeah.
But 11 hours, I can't imagine how they.
We don't know that.
That's just it, we don't
11
know.
hours is working for 700 people now that DeKalb Central has. So adding 300 may not put that much of a load on. We don't know.
But we were going to share it 50/50, weren't we? The increased expenses, right?
Yeah.
So 300's going to pay 50/50 against 700. That don't seem right to me.
Well, that's because DeKalb Central owns all of the facilities and the equipment
And the cost of
and everything else.
So it's just the extra expense.
Yeah.
Okay.
I agree with you, Todd. I think that's a conversation for later.
Yeah.
I know, I'm
totally.
just trying to tie it
Yeah,
all because
yeah,
we're
yeah.
saying that that's going to save money on our policy, but if it's an unknown expense, we don't know that it's
Right.
going to save
And-
Don't
anything.
know that's going to
And
save
on it,
us anything.
standing on its own, there may be some negotiating that can go on there
Yeah.
too,
Yeah,
when you can
Yeah.
focus
Alright.
on that. But it
Absolutely.
could be an
Yeah,
added
absolutely.
benefit.
You know, I don't know that that's critical to have in line with our renewal here.
Yes, okay, I just wanted
Yeah.
to bring it into
No,
discussion, just,
yeah.
And
It's good discussion, good
yeah,
discussion.
it is. And going back to the dental and vision, you can argue the merits of whether those are good policies or not. But so what you kind of talked about last time, pulling it out, make it voluntary.
Yeah, yeah.
If they want to, they can. If they
I
don't
agree
want to,
with
they
That
that.
makes
can't.
more sense than anything.
Yeah, yes, yes.
Yeah. And that's instant premium savings for the employee on the medical side.
Okay, now here's something else that we have been asked several times in the past. You know, you have the employee on the plan, you have the spouse on the plan. Spouse says, oh, let's see, I want dental and vision, the extra, but the employee only wants dental, not vision. Are we going to allow that sort of thing for each individual person on the plan, or it's an all or nothing? If the employee chooses dental, everybody on the group in that family gets dental.
No.
Okay.
They'd be able to elect their own. So if they want employee only for vision, because they're the only one who would utilize it, and family for dental, because their whole family would utilize dental, they would be able to elect those however appropriately they would need to.
And if the
And that's going to
spouse-
come out of their check.
Yes, now that if we make it voluntary, then the full premium would come out of their check for whatever tier they elect.
So that potentially means a single entry for every single person and employee and child in our entire county through the payroll system?
No. So if you go to what page is dental on?
What was that, 13?
I think it's go to 16. The volunteer, yes, the last column on 16. So a spouse just can't elect dental. The spouse has to be the employee and spouse. So if you go to the last column below that thinner dark blue line, for an employee only, it's $25 a month, right?
Okay, that's what Dottie was asking.
That's, yeah.
Yeah.
If I didn't want dental, but my spouse did,
Right.
can my spouse have it and I not have it?
No.
No.
And that was her question.
Oh,
So-
okay.
No,
Okay,
no,
no.
Good.
The employee has to be involved in the transaction. Yes.
Great,
So
good, good.
employee
Just
and
clarifying,
spouse-
I'm good.
Nope,
and
we're
spouse
good.
I'm just
Yeah, no,
clarifying.
it's not.
There was a little panic there.
Sorry for
payroll,
misunderstanding the
but- Okay, now we're
question.
good. Yeah. And the same would go for vision.
Yes, correct.
All right,
Yeah.
so that clarifies that.
So then we go back to the contribution amounts, and I think if we go all the way down to zero, you're potentially opening yourself up to for zero for the employees. I think you're potentially opening yourself up for a second-year disaster of it's zero. This is a lot more costly than we thought it was going to be. We're going to have to add it back in. So that's where we went from. Okay, if we cut it in half, the employee contributions in half, knowing that we've dropped $100,000 off of the cost because of the dental, right? So if we cut it in half for each tier, they're still getting a better deal, right? It's not, you're still collecting a little bit of money, but less by half. But you've lost $100,000 of the dental care.
Here's the problem with that, and I agree with you, that makes a cushion, and gives us a little more flexibility. But what we're fighting with on getting employees and retaining employees is like the city of Auburn. They charge $1 for their insurance. They have the same coverage we have. We're going to lose, if I was looking to get a government job today and the city job and the county job was the same pay, I would take the city because of their insurance. And let's face it, what's the difference between 2.6 million and 2.9 million for us at cost if we can get good employees out of it? You know what I'm saying? We keep talking about pay increases, again, because there's not enough in that net check, but we can give them automatic pay increase up front where they have a lot more cushion right up front. And if we fund to the highest amount, we know that it's real expensive. You know, we already know what the high end
Yeah.
is.
Yeah.
Just knowing that if you do that, you will bring on more employees who, I mean, if you have employees who are electing elsewhere and you bring it down to zero, those employees are going to jump on your plan. There's no question. So those maximum costs, if you're, yes, those would increase as well if your enrollment increased.
But they can only take coverage here if their spouse doesn't, or like their spouse can't come on still unless, if they're offered
Which is good.
insurance.
So if you guys have a spousal carve-out, that's
I think most
a good
employees-
plan if you're going to take the cost down
Yeah.
like that, yeah.
Wouldn't we have to increase the copay then in order to make up that difference?
We can't increase the
Can't,
copay, that's the
thing.
problem.
That's the problem.
That's the
Yeah.
problem, that I thought we were gonna be able to make
Yeah,
our
that's
own
where the
copay
30%
schedule.
would have come in instead of a range.
I'm looking at currently on page 3, your enrollment by tier. You only have 3 employees and their families. If it's free, how many employees and their families, how many more children are you bringing onto the plan that you're paying that family rate of? And at the maximum, that amount is what? What's the maximum, like, per family?
Oh, like 2,889 a month?
So if you bring it down to zero, you are adding potentially, I mean, I'm assuming more than 3 of your employees have children, right? You could be adding a lot of children that were on another plan before.
That makes sense, yeah.
So when you go, I'm baby steps, Bill Murray.
And I agree with that. I think we're, just from a strategic standpoint, a plan with the employee contributions cut in half and equal or better coverage still is a great program in terms of being able to recruit and retain,
Right.
and gives us a 12-month hedge to see what it looks like at the next,
Yeah, even
next
decreasing
annual.
it 50%
Yeah.
could bring
Yeah.
employees and their families onto the
Yeah.
plan.
And with the city offering it for $1, the city must have a lot of openings if you're going to lose all 300 employees to the city, you know.
No, I was saying if I was looking for a job and there's
Right.
2 open jobs, I'll take the one with the free insurance.
We don't know what they're out of pocket though and so forth.
Yeah.
That could be considerably more possibly.
Didn't I read in the paper, they have, what, 140 employees? And wasn't it 2 million their cost for their policy?
yeah,
It was 2 million, which is
Yeah,
high
they-
for 130 employees or
They
140.
they have 86, 89 employees on the plan and
Oh.
about that many dependents.
Yeah.
on the plan,
That many
so.
dependents. So, yeah, what I'm saying is it's not cheap for them.
No.
But their employees love their insurance. I hear it all the time, how we love our insurance.
There's other counties that only pay $1,
Yeah.
Yeah.
because we talk about it.
Well, and I'm
If
not
you
saying-
chose to bring any rate to $1, you would want to choose the employee-only tier
yeah.
rather than extending it to every tier.
And that's not saying we can't get there.
Of course,
At
yeah.
some point.
I'm with Bill on the baby
but I mean,
steps.
jumping into the deep end
Yeah.
right away just is a little
It's a
scary
big
for
question
me.
mark
Yeah,
on cost.
Yeah,
Big question mark.
yeah.
I see that point.
And that's why this thing was in Excel format. You can take the, I think you just said, you can decrease the employee to to where it's virtually almost nothing. Decrease the other ones a little bit so that you're not attracting, let's say, 200 kids or 200 families where your rates really jump up. I just think baby steps, but you can give a better discount for the employee only, or than you can for employee and family. You can decrease that a lot more.
So we could go basically free to the employee, but employee and spouse or employee and family 50% discount.
Yeah. Have kind of a matrix there, stair step.
Or,
Yeah.
or higher than 50%. Now give them the 50% discount.
Yeah. Just knowing that your employee-only count
should
is
say
the
lower.
highest. You have 126 employees who are on employee-only, so.
We only have 3 families?
That was on the PPO.
one plan, yeah, there's
We have
12.
9 on the
9 on the other,
HSA,
sorry.
mainly because the HSA is cheaper. Yeah.
Okay, yeah. Wow, only 9 on the HSA and 3 on the field. That's amazing.
And that's
Could be
because-
covered at the other,
Right, yeah. The other parents' insurance, they might
But
be
if it's-
covered over there, yeah.
but if it's family, they wouldn't.
Does Indiana still
Isn't
have
that, that's everybody?
Does Indiana still have that Hoosiers health plan for kids that's basically
Chip.
free for low company or low
Yep.
income? What's considered the low income on that, do you know?
Yeah, it's Medicaid. It fluctuates every year as well.
It's a percentage of the federal poverty line.
Okay, the only reason I ask that, I have a friend that makes decent money, but he has 9 kids, and his kids were able to be on that program. Doesn't cost him a penny to have his kids basically on, well, I shouldn't say a penny, it costs him very little to be on that. And then he gets insurance through a school that gives him his insurance, and his kids are free. So I thought that was interesting. So that does still exist.
Yeah.
And because of the amount of kids, I bet that's where his
I'm
income
sure.
level, he could earn 100,000, but if he has 10 kids, it might qualify per
Yeah,
kid.
that's interesting. Okay, that is still in effect. All right.
So if you do a, like, 0%, like if you don't charge the employee-only people anything, and then you do a percentage for the rest, you know, even the employee, children, the family, then it's like you're punishing the employees for having a family.
Well, it's not punishing, it's more of, let's just be honest, it's we hire the employee and we cover their health care. The kids and their spouse, we don't hire them per se. In other words,
Right.
that's like saying, well, this company over here also does their cousins. You're punishing by not bringing their cousins in or their dog. You know, I know what you're saying. it does, it's not, I wouldn't say it's that's why I wanted to make it simple and just do 0 across the board, but I didn't think of the fact that, wow, we only have 12 people total on the family. You add another 50 families into this, this is $4.5 million instead of
Absolutely.
$3 million.
Right.
I didn't
And-
even
yeah.
think of that possibility, that there would be more people, but I get what you're saying. What does the city of Auburn do as far as family? Obviously, they must include it since they
I'm
have
not sure.
that many more dependents on it too, right?
Yeah, we don't know.
I'd be curious just because I didn't
Yeah.
realize, they only have 89 people on their plan though? Did I hear
That's
you
what
say?
was in the paper the other day, so I
And then
double checked it.
80-some dependents too?
Yeah,
Whereas we're only 130 some on the policy and another, what, how many dependents do we have?
oh, we have 198 employees on the plan.
Oh, we have 198
Uh-huh.
employees on the
Yeah,
plan.
we have about 300 and something total
Total
belly
employees,
buttons.
so, yeah.
Okay.
Yeah.
So we gain about 30 or 35% of dependents, but they gain 100% of their dependents.
Like I said, that's what I read in the paper, so. And I didn't, the HR director wasn't.
The only
really-
reason I'm bringing this up is I'm trying to figure out how many people might come on our plan with a family if we would go to 0 and try to figure that out.
Well, with
imagine-
300 employees, that a third of which don't want to pay the premiums that you have,
200 employees, but, or on it.
200 do pay
300
it.
total,
Oh,
200 do,
300
yeah, yeah.
You've got 100 full-time employees that are not on the plan?
Yep.
Do you think you're going to add 100 more employees for something that's free? Sure, I'll take that.
Yep. Exactly.
Right? So right there, your premiums have gone up
Yeah.
a month, 897 times 100 more.
Yeah.
Time, you know what I mean? You're
That's
going to attract
significant.
a lot of people.
Yeah. That's
In
something I
my-
didn't think of.
Yeah, in my previous life, we had a tier. When you were in your first year of employment, you paid, say, $300 for your health insurance. The next year, you paid $275. The following year, you paid $250. The following year, so that when you were in your 7th year of employment with my employer, you were at the bottom rung. And at that bottom rung, that's when, and we did not have the spousal carve-out that we have here. All of a sudden, we had more employees who were getting on our insurance and their families. So that increased the cost.
I got you.
And we were self-insured.
Okay, moving forward. Any other questions, comments?
I would say the contributions don't necessarily need to be decided today. The sooner the better, of course, but I would say the plan designs, that's really the important thing. The carriers we're going to go with, things that we could get started, because we really are, I mean, we're 5 weeks out from renewal, 6 maybe.
And what's your recommendation for the plan design and carrier? What are you guys recommending?
So we still stand by the surest with United Healthcare, the 12-12 contract, everything that we modeled out.
Yeah, which page is
See,
that?
that is,
16 or?
so that is, page 8 shows the stop-loss contract, the recommended stop-loss contract,
Okay.
proposed 8 on page 8. And then the plan design is on page 13, proposed 2.
13?
Yep.
Okay.
And then the standard with the negotiated voluntary lines for dental and vision and adding in voluntary life and then replacing your current lines with the surest, or I'm sorry, with the standard. Too many those in front of the carriers. Like the Ohio State University, everybody's got to put that in front.
On page 8, those totals are just the counties or everybody's altogether?
So this is the all-in, these are the max costs, if you see that, 3.07. That, it's the same,
But it's the employee and the county together?
correct, yes. Yep. Again, just like with the contribution modeling, anything you, yep, will offset. You've got it. Yeah.
We don't know what that
3.07,
ratio is.
It's the employee premium cost and county cost together.
Everything together. That's the maximum.
Not their co-pay or what we're
No.
calling the co-pay cost in there.
That's
It'll be
that's
what-
the all-in.
Their deduction, their payroll deduction,
Deduction and stuff, yeah.
yeah.
I guess my suggestion there would be to take the proposed number 8, $100,000 specific deductible.
Okay.
Maybe possibly higher cost, but by only 50 grand, or the 25,000 difference in the, that'd be my suggestion from after reading this, as far as the structure there.
And the slight, just to call out the slight difference in max cost is that we utilize slightly different enrollment numbers on our modeling. I'm guessing they took it off the most recent claims that they pulled to create this. And then we probably just had a slightly different number when we took it to market. So the costs are the same, it's just the enrollment difference. Yeah.
So Todd, you are suggesting proposal 8. Are you suggesting anything with the employees
On page 13.
portion?
That's where I'm a little, I came into this saying, well, just give it all free, and then I didn't even think about
The
that
adverse
we only
selection,
had
yeah.
total of 12 families on the program, or not
Yeah.
even that, or is it?
12, you're right, 12 family.
Between
12
HSA and
families,
stuff.
Yeah,
I
21
think
employee
you-
spouse, 32
I
employees,
think you gain 20 or 30% more people
easily.
if you go all free, and I don't think we can afford it. Like, we're talking.
I don't
$4
think so
We're
either.
talking $4 million if that happens.
Yeah.
From just my quick math in my head,
Nope,
and
you're-
we're currently at
I
2
agree.
million. So
I agree.
I know on the renewal, we're more than 2 million, but.
Yeah,
but
I
after-
understand.
After the employee.
You're talking about overall
Contribution and
increase,
stuff,
yeah.
we're at 2 million even on the renewal.
Yep.
If we go with the cheapest renewal, fully funded.
Yeah.
Or not fully funded,
Full
traditional
insured.
market,
Yep,
what,
you're
full
right.
insured. So you go all free, I think we go to 4 million total cost. And we can't double our policy expense. The idea was to save money here, not
Yeah.
spend more. So I'm not even sure that insurance, I don't think you even give the just employee free now. Maybe a 75% discount for employee, 50% for employee and spouse, and, or not, backwards, 75% discount for just employee, 50% for employee and spouse, and maybe 25% for family, something like that. Because you're right, as much as I want to give family coverage, we just can't afford to.
But we've got to start somewhere.
Yeah,
And
yeah.
that makes, I would certainly rather be more conservative.
Yeah.
In our initial
Yeah.
period here, and then,
Yeah.
you know, we've got a lot more data to work with
Go to this
12
page.
months from now.
Look at this page here, though.
Tan page?
Tan.
Back to the tan page.
Back to the
Tan
tan page.
So the top section, both left and right side, right? So currently, these are the premiums, right? The HSA on the right-hand side, the people that are, the employees that are enrolled in those 4 tiers, 55, 7, 13, and 9, right? That's their premium or premium equivalents, right? The people that choose the PPO, that's their premium or premium equivalent.
Right.
You have a contribution amount already set for the people in the HSA plan.
Right.
And a higher one for those in the PPO plan, right? So if you have, going now, you have one plan, right?
Yeah.
Just got the surest, if that's what you go with. You take those contribution amounts that the ones in the HSA are currently, that they currently have, whatever their contribution amounts off of those premiums are, you take the PPO people and you give those people the same contribution amounts as the people that are in the HSA. All of the people on the 107 people on the right-hand side are saving money.
Right.
Like Dottie said, she pays, that's a break for all the people in that PPO plan, right? They're paying more than that. They're happy that they're paying less,
Yeah.
right? So if you use as the starting point the employee contributions for the HSA plan, all of the people in the PPO plan already get a break, right? If you lower them a little bit for the for everybody compared to what they're paying in the HSA plan, everybody's paying a little bit less, right? Then the people that want to elect dental and vision can do so.
Step it up.
Who's gonna take vision? Think about it. Who's gonna take the vision?
Not me.
Not you. That's darn sure. But those people that probably have families and aren't going to negotiate and,
Yeah.
buy
They
their
wanna pay
frames
for the
online.
service, okay.
So, but it's limited to the people that go to the eye doctor or wear glasses or contacts, or somebody in their family does, right? So, dental, who it's right now 50% or less are taking it. So there are people that find that a value. Those people can pay. They can take some of the savings that they have
Because they have money in their pocket from the
because they have a
savings.
little bit more money in their pocket. And the 50% of the people that didn't see value in it when it was included,
They have that
they don't
money in
have
their
to.
pocket.
And I bet your friend with 8 kids takes family dental because negotiating for 8 kids is probably going to cost him way more than the premium.
So
I think he trades
if
them
you
goats.
do
Yeah, there you
that, by doing that, everybody wins a little bit.
I got you.
Not to mention those who are in the HSA now have enhanced coverage.
Yeah, you have better coverage. Yeah,
By far.
yeah, because my
And
HSA
a
is
lower
pretty.
cost when you go to the doctor, because as I
Right.
said, when I go to the doctor, my fee would be about, my copay, whatever, would be $75 out of that $175 that is the actual charge, but I'm on the HSA.
So you pay
Now, if somebody
$175.
else, one of my coworkers who has the PPO, they probably pay $30 when they go in.
See, I have the Auburn Steakhouse deductible. I have to take Souter to the Auburn Steakhouse every time I see him, so
Great.
I think I'm better off to start
What
paying
a
the fee.
deal.
Okay, I think I got it. Bill, do you understand what they're saying? Mike, you understand?
Yeah, no,
That
yeah.
if we go to a zero cost on the family, we're gonna get hung.
Yeah.
As much as I'd love to give it, it'd cost us another $1 million. Because that's how many people we would gain. But just running quick numbers in my head, and that's not insignificant by any means.
Well, there again, it doesn't make sense to jump off the cliff first time around.
Right.
Let's go down the.
Let's hike down.
Okay,
You don't know
are
how
we in
deep the
agreement?
water is.
Yes.
So are we in agreement that proposed number 8 would be a good plan with the $100,000 specific deductible? That was on page,
Oh, on the stop loss?
8,
yeah,
page 8, proposed 8.
yeah. So that would be, page what, I'm sorry?
Page 8.
Yeah, you're right.
Yep,
Page 8, proposed 8.
yep, 8.
That's kind of where I'm leaning, and then on 13, page 13,
Yep, that's the plan design that comes with that proposal.
that, I guess that makes sense to me. Again, and I get it, I'm not knocking you guys,
absolutely.
I'm disappointed we can't just set these, but I understand their matrix now. They say, okay, we know, here's the amount of redos we have, we want people to go to this doctor, so we're gonna make this their
Right.
their participation or we can't use the term copay or whatever.
say
you want.
cost.
Cost.
Their cost.
Their cost a little lower to try to push them, encourage them. So I would say, I guess we go with that plan, and then the thing to talk about is, what are the percentages? Because I think we need to let's just hammer it out now and get it over with, instead of
We
dragging it
need
out.
to, because we have to do renewal and get it entered in payroll.
That's what I'm saying, we gotta get it in payroll. So, are we thinking a 75% discount for single, 50 for spouse? Or, 50 for spouse, 25 for family? What are you guys thinking there?
We then have we have employee and children. So we
Yeah.
have.
Oh, we have 4.
Yeah, we currently have 4.
4 tiers?
So we have employee only, employee and spouse, employee and children,
And then
and employee
family.
and family.
Okay.
Yes.
Is
So
that how this system would be too, guys? 4 different tiers? or 4 different categories, I should say, of, okay. How do we structure that, guys? I'm open to suggestion there.
I'm a little bit leaning towards one number
Okay,
across the board,
okay.
percent.
A percentage of contribution, one number. So right now, employee only is 11% on, are we looking at the HSA? Is that what we're basing it off of, or the PPO?
Let's base it off the PPO because
Okay.
that would be the higher number, I would think.
Yep, it is, yes.
Yes, because we're going to a PPO plan, so we need to base it off PPO
Yeah.
numbers.
Okay, but is,
Say people are going to get
Bill, are you
Right.
meaning you're wanting to go with one number, like
50%.
50% for all 4?
Yeah.
The
Not,
tier.
Yes.
not these percentages?
Right, right,
So 50% of what they're paying right now on the PPO.
yeah.
Okay,
How
let
much-
me
How much
nail
money
that
would
out
that
right
be
quick.
for, assuming the current employees we have? Let's not talk about any gain.
Yep, okay. I'm gonna do this math real quick. So that would take the employee only to $67.50. We've got.
This is per month?
Is
Yeah,
that per month or per pay period?
per month.
What did you say, 67 what?
50.
Per month.
We got
Okay.
401, 42 times 0.5.
We have 26 pays.
Okay.
I know, I
We're-
have,
We're goofy.
I know, you always have to figure.
I've got it.
So $200.71 on the employee spouse
How much?
here. $200.71
And again, this is monthly,
monthly.
okay?
420.
That's spouse.
Times 0.5. 210, 38
That's kids,
That's
right?
employee and
on
children.
employee child.
It's funny, kids don't cost as much as a spouse if you think
Because
about
the
it.
spouse is more expensive on the
Yeah.
medical plan,
Yeah.
yep.
Tell me about it.
They're more expensive in every other way, though, I can confirm. Those kids. Okay, and then 420.07
Wow. That would be.
as the
monthly
family
for
per
family.
month.
That'd be the new rate.
Yep, so you would be bringing in 293 or 294,000 in premium annually.
So let's see what this benefit is for the employee then in dollars and cents, if we look at it that way. I hate this face ID
So it
crap.
does bring your contributions below the HSA, all the HSA contributions currently, so everyone's getting a break.
So a average employee, just the employee, would be
Yeah.
saving $67.50 a month, right?
Right.
Right,
So times 12, they're gonna have $810 in their pocket. A spouse plan is gonna have $2,400 in their pocket.
26.
And then with children, 2,600. The big savings here would be the family.
Yeah.
420 times 12 is
$5,000.
$5,000.
Yeah.
That's a hell of a huge,
Okay, so this is what
Discount.
the employees are really going to be looking at is the employee per paycheck will be $31.15
per paycheck.
per paycheck, where they're paying either 4605 or 6248 per paycheck.
So it's a,
So these are what the employee is actually going to look at.
at their check, yeah.
but I like to tell them what their annual savings is, and the net
I
check I
understand.
get, it's kind of like payments on a car, what's my payment? They don't
Yeah.
care what the cost of the car is, but they should care what the cost of the car is.
Well, I think we need to stress that. as
And I think we
outdo
need to
the,
stress that even just
the
as an
enrollments.
employee, you're saving $810, an employee and spouse $2,400, that's a significant amount of money. I mean, we're not
Absolutely.
talking about $10 here. This
Right.
is,
No, it's a lot.
now, they're losing their dental, they're losing their vision, but like I said, 50% of the people aren't even using the dental, and you can negotiate a cleaning down to $110. So even if you do your 2 cleanings a year, you and your spouse, you're still a couple grand ahead before it's over
If
with.
they want the dental,
If,
it's
yeah, and they can
available.
buy the dental if they want it,
Right.
for a reasonable cost.
Yeah.
Yeah.
So I would probably, to start this thing off, because we can always change it, I'd probably recommend 50% across the board. I do think at the 50% level, we will gain some families though, so I think we do have to anticipate we're gonna,
Yeah.
by reducing it, we are gonna gain some families here, which I'm willing to do as a benefit to our employees. But council needs to understand this is kind of like a raise too. It really is. You know, they need to say, hey, wait a minute, for anyone that elected family, they got a $5,000 raise out of this deal. You know,
which can mitigate their calculations.
Well, yeah, because someone may take the job just saying, hey, I have family coverage and good family coverage. They may take the job, for that reason.
And we've lost people because
Yeah.
of that.
Yeah.
10 families take it.
So
it's
what I'm hearing,
$29,000.
Say that again?
10 families take it, the grand total raises by almost $30,000.
Per month?
Here.
A year.
A year.
Yeah.
Wait a minute.
No,
A month.
per month.
A month. I was gonna say, that's a month, not a year.
A month, yes.
Yeah, so 360,000 a year.
Yeah.
If 10 additional families
Okay.
take it.
That's what I'm
Okay.
saying. We're rolling the dice there.
Yeah.
But I think, again, the idea is to give some incentive for people to be employed here. The biggest gripe we've had that I've seen is the insurance and the low pay. Those two go hand in hand. If you give more insurance, but people need to see it as a true benefit.
Yeah.
so I'm
Okay.
hearing you as proposal 8 of the benefit renewal,
Yes,
and I'll add all that information in it, with a reduction of 50% of the employee's cost.
from the PPO.
From the PPO, yeah.
From the PPO. Maximum out of pocket for single, 5,000, 10,000, and family, 10,000, 20,000, keeping the spousal carve out and including the option to take dental and vision.
That's correct.
Is that your motion?
That is my motion.
Do we have a second? Motion and a second. Additional comments by the board? Additional comments from the public? All in favor signify by saying aye.
Aye.
Aye. Opposed, say no. Have 3 ayes.
Now, we have the money to do this, right, Susan?
I was going to ask that, is this something the council has to approve, or what?
You're just now asking.
Part of the, it's part of the
We'll
budget.
crank up the printing press, no problem.
Get those printing plates out.
This has to go to,
All right.
to the council as part of the budget for approval.
Yeah.
Can I
Right,
confirm
it
my
goes-
understanding on the voluntary lines, or on the ancillary
Yeah,
lines?
yeah.
Okay. So for dental, we are moving to the proposed 5 with the standard voluntary, which is a match of your current rates.
The dental will be pure voluntary. We're not going to
Correct.
include it at all.
Correct.
Yes,
Pure voluntary.
yes.
The vision benefit also moving to the pure voluntary.
Yes.
And let me make sure I've got the rate proposal. So proposed 7, that has the enhanced progressive lens coverage that we talked about at the last meeting. So
And that
the
was
premium differential is minimal.
Yeah, and that was, how much was that? What page was that, 7?
It is page 18, proposed 7.
Yeah. And
Dental
again, it
is
doesn't
on
matter what we
16.
select because it's voluntary.
Correct.
But we want to give them the
The
best
best
policy
coverage,
they
yep,
can get.
exactly.
Yeah. If they choose it.
So basic life, replacing One America with proposed 3, the standard, on page 19 at a $2,500 savings to DeKalb. And did we discuss that the basic life would stay the same benefit coverage? Or was there any discussion of enhancing the coverage for basic life?
We talked about some life options, I think.
Yep, the
that
basic
I
life.
think were very attractive from being able to be a guaranteed issue to increase the coverage.
So looking at, there's options to increase with the standard, so the proposed 5 would increase everyone to $25,000 except for class 3
That's on page 20?
elected officials, so. Yep, no, you're fine. Proposed 8 raises all to 30,000. That's at a $4,600 annual increase to DeKalb.
I don't really myself want to see any more expense to the county since we're possibly taking on maybe $500,000 in the medical. I think we're going the wrong direction by increasing these ancillary things that, again, I know some people can't get insurance at all, but they're gonna die
Yeah.
broke anyway if they're that way. I'm just
So-
being honest.
no,
You know what I'm saying?
absolutely. So
20
looking
grand
at-
is gonna fix anything.
Yeah, let's take a step at a time here.
So-
I think we're,
Proposed, then looking at proposed 3, the savings of 2,500 with the same coverage.
Same
Okay?
coverage.
that would,
Yeah.
yes, I would be in favor of that.
The same coverage, but keep in mind, by moving to the standard, your life and AD&D for a line of duty, an officer in the line of duty
Yeah.
doubles.
Doubles,
Right.
correct.
So it's
So that's
better benefit,
still a great
less.
benefit.
Yeah.
And then adding page,
The payout doubles.
Yes.
Yes, yes, yes. Not the premium, the payout doubles.
Right.
Yeah, I read that, yeah.
page 23, this would be the addition of voluntary life with the guaranteed issue of the employee of 250,000, so they could elect one time.
We don't currently have that in our group of
Right.
benefits that we offer.
And this was the one I think you really
Yeah, the
liked.
voluntary life,
And so
yeah.
this is 100% voluntary. The employees can choose to take it or not.
That's fine. I
I
don't
like
care either
that,
way, whatever
yeah.
they want to do is,
Yeah.
I just don't want to be anyone's financial or life insurance, like Mike's a
Right.
licensed agent, he can give advice like
Yeah,
this.
sure.
I'll set a standard per se, but I don't,
Right.
you know.
So page 24, moving the ASO short-term disability to the standard at the same rate. So no rate change, just keeping the carriers packaged for ease of administration. And then the voluntary long-term disability, moving to the standard at a decrease of the current rate. So this is voluntary now, it would stay voluntary, the employee would just pay less if they elect.
That's fine.
Okay?
What page are you on?
Page 26.
But we currently have LTD for the sheriff's department employees that the county pays for. It's not
Right.
voluntary.
So those employees would still be able to take this with the decreased rate. Yeah.
Okay, so our sheriff's department, we know that the county pays for their long-term disability, and then we allow any other employees to purchase long-term disability if they care.
Okay.
Was that proposal?
Proposed 3, the standard. Page 26, proposed 3.
And what's the difference between that and 2?
So proposed 2 is MetLife. That is a different carrier.
Oh,
Yeah, at a higher rate, yeah.
Okay.
They weren't really competitive.
Feel like I'm getting an eye exam. Is one better or two? 2, 3. They're all blurry.
I don't want to take it. I don't want to take any assumptions and run with them. And then as far as voluntary accident, critical illness, and hospital indemnity, at the last meeting, we had decided to table these for next year. Is that still,
Yes.
okay?
Yes. Or that's my opinion.
I agree.
Okay.
Do we,
okay, so for page 15, proposal 1 is what we went with for dental.
No. Page 16, proposed 5.
Yes, the standard again, right?
Yep, the standard voluntary.
Okay,
Sounds like a good name for a company, the
The
standard.
standard. They're setting the standard.
Then you've got the vision.
and then vision is 3.
Page 18, proposed 7.
Lord have mercy.
We're going to get there.
Okay. All right, I think.
Because that was the better package if someone
Yes.
wanted, that gave them.
The better network, the stronger network, and yep,
Got
stronger
it.
benefit.
Okay,
Good.
I'm good.
so,
I will send a recap with the contributions that we discussed, and if you could just send me a confirmation, and
And is all that we discussed with vision and dental, was that included in Todd's motion and Mike's second and
Yes.
vote?
We took it out, that's all that really matters for us,
Voluntary.
is voluntary.
all right, but let me ask you, okay, so we were looking at, on page 17 for vision, proposed 3, correct? The IMED access.
Yes. No, it was page 7, proposed 3. For the voluntary vision.
It was page 18, proposed 7. There
Oh,
were
I'm sorry.
You're totally fine. There were 2 different voluntary proposals
Oh, there it is.
for the
Okay,
2 different
all right.
networks,
Yeah,
so it's
gotcha.
confusing.
Yeah.
All right, so that list, employee coverage at $5.36 a month.
Per month, yes.
Would that be, if it's voluntary, would that be their
Yes.
premium?
So we had looked at,
So it's
for the,
$2.70
it was actually,
paycheck.
they gave us a lesser rate for the voluntary than when we were looking at the employer paid line,
Okay.
so that's great.
So
Yeah,
$2.70 a paycheck gets them
Yep.
their,
Employee only.
the good vision.
It's full coverage, not just the, yeah,
Right, okay,
exactly.
all right.
Which
And-
if they're gonna do it, they might as well do the better one.
Well, yeah.
IMED also does discounts on top of like the $130 allowance, so they negotiate discounts just like Anthem did, and yeah.
Okay,
Okay.
Okay,
I think we're there.
there.
Right
Right
in
up to
time for break.
Right up to break.
thank you guys so much.
We charge $1,000 an hour for Commissioner Court
For
time.
these meetings?
So we take
Okay.
that off our
That's
first
on
bill.
bills, yeah.
Okay.
That's on bill.
Thanks, guys.
Thank you.
Appreciate the hard work and giving us multiple options and scenarios.
course,
And
yeah.
thank you for educating me too on the fact that we might gain a bunch of people, because I would
That's what
have.
we're here for. Yeah.
Yeah, but I think though with the 50%, don't you agree that's a nice?
Huge benefit.
If I have a family, I'm looking to DeKalb County for or for employment now, because,
And to actually
It's nice
reduce the
savings.
cost of premium, I mean,
Yeah.
that doesn't happen anymore, so
Yeah.
that's amazing.
good. All right, break?
Break.
It's your turn this week, Mike, isn't it?
Probably so.
I think so.
Yes. I'll send you term letters. Sign, whatever. Okay.
See how a year goes, and,
Well, yeah.
you know what I'm saying?
Yeah, that's the thing.
We don't know.
Mike,
Bump up if it's gonna be. Actually, it might be a decrease. This year's budget. So the changes happen.
Yes.
This happens because it happens every year. And it just wouldn't work if they.
And we can't, visit the council first, the commissioners have to sign it. And the council.
But
they're
because
gonna
this is
fund it.
happening.
Like last
It
year,
doesn't
I
all
would have,
necessarily fit, but it.
last year when I did the budget.
But there's no way you would know whether we would cost, well, you would increase
But
it a
I
little bit.
increased it by a certain percentage, so I had plenty in that month.
So it should be fine, especially with the lower premiums for the fact this is gonna be like a contract. Well, this could save the county money and make employees happy, potentially. Potentially. And then it's on you to decide to plan it all. You'd have to be somewhat, I mean, you are sharp, but I'm just saying, to be the auditor, you'd have to be somewhat sharp. Because if you're not, I think maybe in the past
We've had issues.
somebody
Yes,
that,
yeah. Yes, we have.
Oh my gosh, I'm tired.
I know, my head is spinning.
It's like, you got a bloated brain. Okay, everyone, get Susan seated. We're back in action. Ben, good morning.
Guys, how's everybody this morning?
We're brain dead, but we're here.
Brain did, but good.
Well, I got quite a few things here this morning too, so I hope I don't add to it too much.
Oh, Benjamin, you're going to.
I'll try to make it quick though. Well, today we have a bid opening, but that's at 10:30 for Bridge 57.
Yep.
So I'll hold off till 10:30 on that. I'll move on to Bridge 132. That was sent out to all you, I remember last week, week before. This is the one on County Road 72 that's going to be the replacement to a small box structure. Didn't know if you guys had any questions or concerns. I did send this off to Mr. Cruz for review. If you guys are okay, that one can go out to bid today. Bids will be due June 19th by 10 a.m. and open here at 10:30. I got an advertisement date for May 26th and June 2nd. That particular project has got, for the closure, they can do it any time after notice to proceed. And then by the plans, the closure is supposed to be open by September 29th. And then the bridge 100% complete by November 1st. So they can do some off-site, grading, leveling, things like that. The one I sent you guys, the notice to bidders, there was a correction that I had to have made because I originally had it at 8:30, the bids was due, and I had it changed to 10, and then noted that the bids will be open at 10:30 on the 19th.
19th.
So, but if you guys didn't have any concerns or questions, or if Andrew didn't, I'd like to move forward to take bids on that.
I think that's, as far as I'm concerned, that's the way to go. Let's move on forward with it. Everybody in agreement?
Yep.
Okay.
Anybody making a motion for him to move forward?
Do we need a motion on that?
We normally do.
So moved.
Thank you.
Second.
Second, we have motion second. Additional comments? All those in favor signify by saying aye.
Aye.
Aye. Opposed, no. Motion carries.
You're no?
Opposed, no, I'm an aye.
You're an aye.
Signify by saying no. I'm
Okay,
sorry.
okay.
Yeah.
So
You can't
three,
confuse me.
I know, I was like, wait a minute, what? So 3,
forgot.
4. I got it.
It's 3-2.
I will send you, I can give you this copy, or I'll send you the new one. If you want, that was just corrected today. I'll just send it to you. Okay.
That way I know I have what I'm supposed to have.
Actually, I guess I got ahead of myself. I should have brought something up on Bridge 132 first. I apologize. Bridge 132 has got, on the 4 corners of the bridge, I'm trying to seek right of entry agreements for that, and have not had success with getting a hold of, there's 5 landowners I've gotten a hold of one. I've sent letters to all of them and tried to catch them periodically, and I've not gotten no response back. I went to, I spoke to Andrew, and also I spoke to Michelle at the DeKalb County Drainage Board, because where we will be along the road right of way, we're also gonna be within the ditch right of way. So I wasn't too concerned about it. I thought we could get with the Drainage Board and have a variance or an agreement to allow us to work within the county drain easement. Well, during that, I found out that the Metcalf ditch is all Allen County.
Oh, is it really?
Since it comes out of Allen County, goes in just a little bit, I mean, it stays within 100 feet of the road and then turns and goes back into Allen County. So since the majority of that ditch is in Allen County, gotta go to Allen County Drainage Board. So last week I contacted Mike Frucci, the Allen County surveyor, had a good discussion with him, and his comment was, we like highway departments, we'll work with highway departments. He did not see any issue with this going forward. This is going to the Allen County Drainage Board June 1st for their approval for us to work within their drainage easement. So since this is out to bid, it's fine, we can make some amendments, or if we have to, we can pull it for some reason if it fell south. I didn't speculate it. They sound very accommodating with that, because it's our road jurisdiction. The South County Line Road is our road to maintain, enforce our bridge, so it just makes sense to work with us. And they said typically, other people, they don't do that with in their easement, but highway departments, and it's our corridor, they did not speculate any issues.
And Ben sought my advice on that, and I thought that was a good plan. I thought it was a low risk
Frucci's a really good guy.
It
option.
was. So I apologize, I got my notes turned around, I should have corrected that before we.
It's fine.
But I don't really speculate any issues with that. Like I said, we're gonna be basically in the road right away, but a little bit out of it, right next to the bridge. So that's why we try to seek right of entries. That way we have our own easement instead of using the regulated easement, but there shouldn't be no problem.
Okay.
I can start on this. The other thing I've got a little issue with a utility company in the county that's been working. They started this Surf Internet. They
Knew
started.
that was gonna be an issue.
Yeah, well, yeah. They started at Country Middle School up there at County Road 10 and 23. Their plans was to come down 23 to 28, and then I got them stopped at 28 and 31. And then they was gonna take 31 south to DeKalb High School, and then they're taking 28 on over into Waterloo, okay? Their permit was stated that, well, we have a standard in our permit that all utilities will be within 2 feet of the back of the right-of-way, and a minimum of 30 inches in depth. On his, when it was submitted that all lines would be bored in, which that's the way we like to do it. Well, when I got them stopped, pieces of it was bored, but a majority of it was plowed in. So it's been like this throughout the whole corridor. What caught our attention a few weeks ago when we got some rain, they plowed right parallel to 23. Well, of course, then when it rains, it all settled. We had a trench right next to the road that, something was going on. And then at 23, just north of 28, they hit a crossover pipe, pulled that out of the ground with their knife. Just the groundwater crossover pipe, they pulled that out. They went down 28, and, there's a fence parallel to the field, there's a mailbox where they should stay in the backside of the ditch. They drove out. I tried to print off some pictures, but they didn't print out real well. This is their cable down in here. So they come out, down through the road and back down.
It went into the road?
Yep.
Yeah.
And this ain't the only spot they've done that.
Into the road, wow.
It's been a mess. It is in conduit. I found one spot where the ground settled that we went up there and taped, and it was 24 inches deep. Well, it's supposed to be 30. The places they bored it, they done a good job. Most of the county road right-of-ways, you've got trees, you've got soft areas, you've got banks. There's no way you can really drive that plow
Right.
and stay consistent where you need to be.
At the backside, especially.
Right. So, and they're supposed to be so far away from a utility as well, but there's issues with utility companies because, you know, our right-of-ways are getting very cumbersome with utilities. I understand that. But we also have a road and ditch to maintain. So there's areas, this is in the bottom of the ditch, it's parallel to the road. I don't like them parallel to the road because it's bothersome to homeowners putting mailboxes in. It's hard for us putting signs in. So we got them stopped, had a discussion with them. The guy, they're also supposed to, when they're in the counties, carry our permit with them and the plans. I don't think the field team had that. They wasn't aware of
Sure they didn't.
they wasn't aware that the plow couldn't be used and it shouldn't even been on site because it should all been bored. So they didn't even have a,
Yeah, that was the company that we required the 10,000, or the performance bond.
Right, yeah.
right?
Yeah.
So there's some things I think we're gonna do moving forward. I'm working on with Kelly. I wanna change our permit and I think for one, we need to charge for these a fair amount. Because there's been a lot of work that's went into this. So anyway, I stopped and met with them. They went back along the road and filled all that, packed all that. They did dig several areas to verify the depth. It's gonna be hard to pull that conduit out. That conduit's probably always gonna be there. So the thing that's aggravating, whether we even make them move it, whenever we dig, we're gonna hit a cable and think, oh my. You know, and we ain't gonna know whether something's in there or not. That's a hindrance, but the cable's already there. We had a discussion about doing a hold harmless agreement with DeKalb County and Surf Internet if we allow them to leave this as is, where it's at. It's not ideal, but I'm gonna be honest with you, they're not the only one that's done this. We've got a mess throughout the county, how they've done it. It just happens we caught them before the project was done or prior. They're acceptive at this point, it sounds like, to do a hold harmless agreement. That is to hold us harmless if we dig in the road right away, and we're gonna call for locates, but since it is placed wrong, there's a possibility we could hit it, or for any drainage structures or easement or crossovers, per this, they would be reliable and responsible to move their utilities to accommodate us with what we need to do. So I emailed this to Andrew last week. We had some discussions back and forth, and he made some recommendations as far as if we decide to go that route, having someone a little bit higher up write a letter, maybe even put it on a letterhead or some type of agreement form, and allow them to keep this in there. As of now, I've got a stop work order on them. They're stopped at 31 and 28. And they're kind of wanting some answers because they do have deadlines, but I wanted them to stop because I knew if I let them go and then they got done, getting them to finish what they damaged would be hard to do.
You need some leverage.
So I wanted to bring that up today for a little bit of discussion, let you know, and see if you guys would have an issue or would entertain possibly doing a hold harmless agreement with them for this route. This route's going to serve all of Waterloo schools, and then it's going to continue on. So this is going to be a major fiber to have not placed correctly. That was some of my concern. So,
What do you think, gentlemen?
or if
Harmless
Andrew's got
agreement?
something he'd like to, unless you had something you want.
No, I'm tracking with you in what you'd said, so, I mean, it's, I guess, just a judgment call on what you got, gentlemen, want to do. They violated their permit, so I would think we'd have an ability to tell them to go back and rip it all out.
I believe we do. And they didn't argue that, if that's what we were required to do. They didn't argue that.
And then if they put it in, would they be able to do it better by boring? That's how
Yes.
they could do it better?
Yeah.
It would stay at the back of the right of way, and it would be consistent depth, and it would be a better consistent line, other than maybe a utility or a few, but
Couldn't we give them grace on what they're at now, but have the hold harmless? If we rip up anything in that area, it's not our fault.
Yeah, that would be the.
But going forward, you gotta bore everything.
oh, they are.
Okay.
Yeah,
I
they're,
think that's what we ought to do.
We've,
Hate to see them rip out stuff that, even though they screwed up.
Well, what Ben said is that these places will pull a permit, like, that's good for like a year.
Yeah,
And so Ben can't be out on every stretch of road for all of these permits for the whole year, so
And they're
that's
supposed to
why,
notify us before they start.
but they didn't call him ahead of time, so
Well,
he
then-
couldn't catch it.
We have that problem continuously with the drain permits too.
Okay.
And the Drainage Board is requiring a performance bond from SURF
Okay,
to work around the drain work, and we're probably going to require that on utility permits in general, just because of situations like this, because a lot of times the contractor and the people who pull the permits are two different entities, and the contractor never sees the permits or the requirements or anything else. So,
Like I said, I would like to see, I'm working on some stuff, and I'll get to you guys. I want to strengthen our permit.
Yeah.
This ain't the only one. We're dealing with
Well, I
other stuff
know.
right now. and
We got to get a handle on this.
yeah, and I'd like to see maybe some consistency between Drainage Board requirements and highway.
And me and Michelle's talked
Yeah,
about that.
yeah.
Yeah.
So we might as well all be singing out of the same hymnal.
I think what we're going to do is charge by the foot, or
Oh,
however linear feet they're going to be putting in the county.
Yeah,
We'll charge
minute-wise.
accordingly.
That makes sense.
yeah.
So if you guys don't mind, I'll pause for a minute here and do our bid since it's 10:30, and I know there's
Yep.
people here for that. So with being 10:30, I'll move forward with opening the bids for Bridge 57 on County Road 40. So I have one bid here, Susan, from Milestone. I have a total bid of $158,757.60. I have one from R.L. McCoy. The $172,439.90. I have one from Pioneer and Associates. $219,044.90.
I assume you take that under advisement, come back with recommendation.
Yes, I need to. Monday's Memorial Day, so you don't meet,
Right,
so it'll be the following Monday. I'll bring back a recommendation for you guys.
okay.
Have a motion, to take these under advisement, bring back a recommendation.
Motion?
I'll make that motion.
second.
Okay, motion second, additional comments? All those in favor signify by saying aye.
Aye.
All those opposed signify by saying no.
And just so you guys know, I've got an updated, this is as of Friday, updated engineer's estimate from United of $178,819.
On this one.
Yep,
What did you say?
$178,819 was the engineer's estimate.
Who made that motion?
Todd.
Todd. That's what I thought. Okay.
Mike made the motion, I seconded.
Any of you guys have questions on anything, or? Hey, thank you guys for bidding and coming in, appreciate it. We'll get a bid tab out as well. All right, thank you, guys. $219, $158, $172, then the engineer's estimate was $178. I got 200 and one over.
Yeah, quite a bit. Have you had any experience with them?
Milestone is a big company based out of Indy. They just recently bought Speedway and things and moving up this way. Milestone's a big company. I haven't worked with them personally, but they've got a good reputation.
Okay,
And we've worked with R.L. McCoy, they're second. And then Pioneer, I haven't done.
okay.
Big savings, I mean.
There is, yeah. Yeah, so I will get through that. I'll just so you guys know, that's Jeff Larson in the back. He's with United, so he's here for the bid opening today. So back to Surf Internet. What's your guys' feelings or opinion of a home hardless agreement? That is something I'm looking at, trying to maybe even incorporate in our permits moving forward. Because like I said, our right-of-ways are getting very cumbersome. We've got an instance down on 60 where they're out parallel to the road, but from the edge of the road back, it's taken over with utilities. We do have leeway with utility companies. As far as specifications and requirements, we can stick to them, but we really can't just out deny them. Then we get the Utility Regulatory Commission after us. You know, he told me, the guys particularly down there on 60 said that there's some counties, not here, that's allowing them even to bore under the roadways if they stay at a certain depth because of the cumbersome of the road right-of-ways.
It's getting too crowded.
You mean that they'll just bore under the other side of the road and then go down there
they'll
without
just-
many
They'll
utilities?
run parallel under the road.
Under the
Oh,
road.
actually, under the road?
Yeah.
I'm not,
Good grief.
I'm not really real in favor of that, but
Like a mini, small underground tunnel under the road,
Yeah, just conduit.
cable.
conduit or
How
something.
far under the road would that be usually if they bore under the road?
We can set a requirement. We require, I think it's 48 inches under our roads now, minimum depth. So we could set a standard for that. I'm not really, that's just, because the problem with that is if they don't hold that standard by state law, we have to locate to that utility, that same depth and then 2 feet below and around it. Well, then whenever we dig in a road, it's a lot harder to locate in a road than it is in the right of way. And then
I
if
don't like that idea.
it does this, we make, hey, it's there, it's 3 foot deep, we start skimming along, all of a sudden we hit it at 1.5 feet. I just,
Plus the fiber line, a foot and a
yeah,
half under.
it's aggravating, I'll be honest with you. I just assume have them put it overhead when they can't get the road right of ways, but they argue about that as well because there's more chances of ice or people hitting a pole and damage and losing
Well,
internet.
getting in and out of the fields and so forth with
Right,
height
so-
situations too.
We can require different routes, maybe. We have had some utilities that, that's changed a route and still get from point A to point B, wherever that may be. Because it's not necessarily, it has to go down a corridor. Now, this one here, the surf is incorporating all them homes down that corridor. I mean, through the internet, out in the rural area especially, people's probably really thankful to have it. And I understand that.
Absolutely.
This surf, is it fiber?
Yeah, yeah. They have a contract to run fiber to all of the schools in the county, and they're at the same time working on whatever else they can sell as far as, I know they've been talking to Waterloo and so forth, but they're new to DeKalb County. You know, we have no idea, you know, what their performance level is going to be in terms of the installation.
Who's funding that?
I don't know. It's
Huh,
I didn't even know anything about it.
I'm sure it's there's some federal money involved because of their focus is schools.
yeah. I assume anybody along that route can
Yeah,
service off of
yeah,
that service.
they'll run fiber wherever you want.
Yeah.
I don't have a problem with the hold harmless agreement. I think just because we have more and more of these permits coming through all the time, that, and maybe we need to have some discussion between the surveyor's office and the highway department, but I think we need to plug an inspector position into the '24 budget, because you don't have any personnel who can go out and ride herd on these things. The surveyor doesn't either. Everybody's
Because if
shorthanded.
you don't monitor it, they can cover, some of them can cover a couple, 2-3 miles a day.
Yeah, and considering all the moving parts with this thing, I think having an inspector that would be able to, we have more of a set procedure for notification, where they're working, inspector to go out and ride herd on this, I think would be a,
Well, and I also think if we, for one, if we charge for the permit, and then two, if we implement penalties and fines
Yeah.
for non-notification to the highway department and
Yeah.
proceeding without
yeah.
field meetings, we gotta have a backbone to this.
Yeah.
Because right now, I
Yeah, if you
don't.
don't have any teeth in it, it's
Yeah,
it's worthless.
So I think that is one of the biggest key things to look at. and
That's the
also
first
what-
thing.
Yeah.
Yeah.
But again, I'd
Yeah.
like to see those for the drains and highway.
I agree,
parallel.
I agree. It just goes hand in hand when they run these lines underground or utilities.
Because to be honest with you, I was looking at, I'm kind of replicating Allen County's permit, and I don't remember the exact cost per foot off the top of my head, but some of these permits can end up costing $4,000 or $5,000. So I think with that, and with the surveyor, this could potentially even pay at that position. I know talking to that lady at Allen County, of course, it's a bigger county.
Yeah.
They charge for every permit, but their revenue is just over $300,000 a year
Yeah.
off permit revenue.
That would be, in my mind, the goal,
Yeah.
as far as having an inspector.
Yeah.
And that's to fund it with the permits.
Yeah.
That'd be a have to.
Yeah.
And I think it would almost be achievable. I mean, because I could.
Two
I could put a-
combined.
Yeah, I think so.
Right. So I think, I'll work on it some more. I got Kelly working on it. Because this was just the last one. I've been wanting to work on it, and we got to get something with some stigma to it to hold these
Yeah.
people more accountable. So, and then if I get it drafted, I can get it to you guys, and then I can also get it to Mr. Cruz and let him review it, and
Yeah.
then we'll have to have a public hearing on it. It'd be a finable.
Yeah, right.
I'm sure it would have to
Yeah.
go that way.
Yes.
But
Anything with a fine.
I'm afraid if we don't start doing something like that, we're going to be having this conversation a lot.
Well, yeah, that whole segment is not going to get any less busy than it is now. It's just going to,
I'd like to have
Continue to
something in
grow.
there, even like first offense, we'll have a fine, second offense, you're gonna have a bond, and then the
Yeah.
fine goes up, because
Yeah.
something,
yeah,
because some people are really great to work with. They are. Some utility companies come in, has been just absolutely great. Even with some of the big ones, we've had a lot of issues with AEP,
yeah,
putting poles where they're not supposed
Yeah.
to, and they're a big utility company.
Right.
We had to move, I think, 7 utility poles on 35
Really?
years ago. Of them great big ones,
Were they too close to the road, or?
yeah, it was right down in the ditch line.
Wow.
well, we've had them lay fiber right through a county drain and, so,
Cross pipes,
yeah.
you
yeah.
name it.
So how would you want me to do, is there for this home hardness agreement, I necessarily don't have a draft form. Would you just like an email from them, or should we have Andrew put together
I think
something?
we
or-
need a
I think we
form-
should have
need a
something
formal
signed by
agreement.
them.
Yeah,
So
absolutely.
I'll make a note to do that.
Yeah.
Okay. Then I'll let them know that we're getting something together, but now it will be that following Monday for you guys can approve that, so you guys would be okay if I let them proceed, because I hate, they won't be very happy if I make them set 2 more weeks.
Well, you could tell them that you could get from them in writing that they're willing to sign a hold harmless agreement, perhaps, if you wanted to do that.
And if they do that, then they can proceed.
Yeah, and then I'll draft it up here, and then they can vote on it
All right.
2 weeks from now. I mean, that's an option.
Any more violations though, and they rip it out at this point? I mean, if they can go on down
Yeah.
28, and if they got something that's
Yeah.
not proper,
Tear it all out
Gotta-
then.
gotta do
rip it
right.
out.
We don't have much left on 28. They've got all 31 that's our jurisdiction.
Yeah, 31 down to high school.
Is that my truck out there?
I have no idea.
Board, you gotta hold it way up here.
It is not.
Didn't think I hit it. So if it is, I'll fix it. All right, I will email them and let him know that, and then, okay.
Okay. What else you got?
Calcium started, just so you guys know, it's going slow, because it's been awful cold in the mornings and the nozzles are freezing.
That's
So,
something.
it
Do they
needs-
freeze because the calcium itself has a lower temperature coming out? Or, I mean, when it atomizes or something, is it freezing the nozzle?
You know what?
Because it's 48 degrees this morning, so there must be some atomization cooling
It had to
effect.
be.
Yeah.
Anything, if they're having trouble, anything below 60, we've been having
Really?
trouble.
Okay. Must be
Even
some
in the 50s, we're having trouble, them outside nozzles are freezing up.
freezing up. Must have something to do with the chemical.
Mm-hmm.
Huh.
Well, this week should improve that considerably.
So it's been a little bit slow going, and they've got one distributor here, the smaller one of their fleet, so it's taking a little bit longer. But they are progressing, so.
Great.
Other than that, we're just getting ready to move on with projects. We are scheduled, County Road 54 FDR first week of June. So we sent notices out to all the landowners Thursday. Mark delivered all those and stuck in their doors. Let them know there'll be a little bit of inconvenience.
Yeah.
What's happening on that road?
We're doing an FDR on 54 between Garrett city limits and 17. Full depth reclamation. We're gonna go in and grind the road.
I thought you were talking about a Franklin Delano Roosevelt.
No, that's all right.
Full depth what?
Reclamation.
Restoration.
Full depth restoration, a
Got it.
partial depth.
Well,
Okay.
not totally. We're grinding it 8 inches. And we'll we're grinding the road. We're gonna put Portland cement in it. And then we'll go through and regrade it, then chip over it.
Cool.
Hopefully take care of some of the subsoil issues we have. So that's all I have.
All you got?
I do have one thing that, and well, I guess it involves you. We received an amended letter of credit from Wayne Asphalt for
Huron Lake.
Huron Lake today, extending the expiration date to May 20th of 2024. So if you guys would like to acknowledge that you received that.
I'd like for them just to keep it. No, they've done that.
What is
for-
the announcement for? What is it?
That is serving as their performance bond for Huron Lake, because we've never went to a maintenance bond because they've never finished the
Never
road.
finished.
There's a lot of, there's issues with the curb, there's issues with the road, and so Jim had that letter of, irrevocable letter of credit instead of a performance
I
bond.
got it.
And that is through Wayne Asphalt for that Huron Lake addition. That's been going on for
A long time.
5 years, 6 years.
Thing's been crazy.
They are building out there again.
Yeah, I see.
That's what that letter's for, so.
I'll acknowledge receipt of that from here.
Thank you.
I'll second that.
Motion is second. Additional comments? All those in favor signify by saying aye. Aye. Those opposed signify by saying no. All ayes. Anything else?
Not for Ben.
Not for Ben. Okay.
I got one thing, just since it involves Ben, I think we need to reject Mr. Hill's application for a variance on that driveway. And that road too is not safe at 55. I told Ben agrees with me that road 55 is too fast, so the study, I'm interested to see what the study comes up with, the NERC. And
Do we deny the variance?
I think we need to deny the variance at the current speed limit.
A motion?
That's my motion.
Second?
Second.
Motion is second.
Didn't really have a formal application, so I don't know.
Yeah, well,
that
at
there's
least,
anything to
but we're
deny.
making a,
But yeah, I'm.
He came in and made a verbal application.
Yeah.
Yes.
so for now,
Yeah.
until we get we need to see what the study says.
Okay.
But I think we need to reject it at the 55.
All those in favor signify by saying aye.
Aye?
Aye. Those signify by saying no. Okay.
Okay, so you denied that at the 55 mile per hour request.
Yeah.
Make sure you have that all right.
The road's currently 55 mile per hour, so we have to reject it. That road isn't even safe to drive on at 55.
Well, there's other driveways that are,
And there's
In
other.
parallel.
A couple of little hills that are up like
Oh,
that, I
it's,
drove out
it's
there.
just rough
Yeah.
and it's just and it's what, Ben, that stretch is less than a mile, isn't it? Or about a mile?
I wouldn't think it's much more than a mile.
It's 55, you would be very rough roller coaster ride. I mean, 45 is plenty fast on that.
okay, let's jump into payroll.
Actually, we don't have that.
We don't have that.
I left
We
it
do have
on there
minutes,
just so I don't
though.
forget.
Okay.
So we have claims and
We
minutes.
have claims.
I'll move to approve claims.
Second that?
We have motion second to approve claims. Any additional comments?
Good one.
All those in favor signify by saying aye.
Aye.
All those opposed signify by saying no. Minutes. Read the minutes.
Yep. I have a question on that. No, I didn't have a question on that. I'll make a motion to approve minutes.
Second.
I do have a question on that. There was a claims of this, what was it? Oh, I know where it's at. I didn't write it down. It's just.
Are we talking
hard
about
to-
minutes or claims?
Claims.
We already approved
Claims.
claims.
Minutes. You're right.
Maybe the claims in the minutes.
Yeah. Okay, we got a motion and second on minutes. All those in favor signify by saying aye.
Aye.
Aye. Opposed, say no. Travel.
Comment.
I'll move to approve travel.
Any additional comments? All those in favor signify by saying aye.
Aye.
All those opposed signify by saying no. No. Positive Recovery Solutions, DCCC. What do we got there? I think I read that.
That was from Michelle Fosnell.
I didn't really understand it. I mean, what do they
Did you
do for
go
us?
that, Andrew?
I had reviewed it a while back, and I don't think I had any issue with it. I can pull up my list here.
They actually do for us.
It's supervised medicine.
Addiction-related medicine,
Yeah.
isn't it? Yeah.
But it is okay.
It allows them to get the medication in and handle it there.
I read it, but I wasn't sure what I was reading. Is there an amount charged for this service, or is it per rolling? I mean, what do they charge us for this service? Is this reimbursed by the state then, I assume?
Yeah, it's
Part of the grant?
Or the grant reimbursement?
There's no amount, that's when I read it, there was no amount that they charge, it's just that the contract, accepting the contract. Did I miss something there, Andrew?
Trying to locate my notes on it since it's been a little while, but
Paragraph 6. Just the way that paragraph reads, it looks like that is charged through to the community corrections participants.
Okay,
Participants.
that's what I was wondering, because I did read that, but I didn't see an amount, and I didn't know if we, yeah.
It says
So
all,
it's direct
all
pay
in-
to them
all income received
from the
goes to-
participants,
goes to the-
residents?
Yeah, goes to,
Okay.
I did not get the idea that it was a bunch of new expenses
no.
for some reason.
Yeah,
Okay. Motion?
I'll move to approve the agreement with Positive Recovery Solutions for community corrections.
And I will second that.
A motion and a second. Additional comments? All those in favor signify by saying aye.
Aye.
Aye, opposed, same. Motion is approved. Okay. Anything else? Miscellaneous topics? Anyone?
We have the RCF salvage agreement with, for the highway remediation and is it Barnes and Thornburg?
Yeah.
We're ready to pass this, right, Andrew?
That's where they're gonna remove their equipment, right?
So that was with the,
Some equipment they gotta remove from the
Yeah,
site, is
they're
it?
just salvaging whatever's there, the
Yeah.
monitoring equipment. Yeah.
From the old
Yeah, from the old highway
side?
department, which is fine with me from what I read. Their
it was
equipment,
involving the gas tank or something.
Yeah.
Yeah.
fuel cells underground that
Yep.
leaked. Yeah.
I'm fine with it. I don't know the whole background, but it made sense to me. I think it was all done a number of years ago.
Does the city of Auburn have to be tied into this too, since they technically own the property now?
This
Yeah,
is
'cause
our part of
The
it.
original agreement was between the county and Barnes and Thornburg.
Gotcha. So, I just didn't know if they needed to be,
Well, because you're saying like this
Notified.
is they're gonna come in and pull the tanks out, or have they already
they're
done it?
pulling out
No,
their
no, this is-
remediation
This is
equipment.
just monitoring
Okay.
equipment.
Yeah.
I think you should at least notify, somebody should notify the city about that,
Yeah,
I
the-
guess. But the city knew this when they were
Yes.
buying the
Oh,
property.
yeah.
Yeah.
So I think we're okay to go forward, but they should probably notify them.
Actually, we didn't disclose to them, that's full of all sorts of heavy metals.
Wow. Man,
Okay,
Hey, we're past our 2 years, we're good.
right. Motion?
So moved.
I'll second.
Motion second. Any additional comments? All those in favor signify by saying aye.
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 Opposed, the same. Motion carries.
Looks like it has a spot for witnesses, but it says Board of Commissioners, but only one's
It'll just be Bill.
just billed to sign.
Yeah. I have 2 items here for you to sign. I'll have another one coming for today's claims. And then before you leave, I have a whole folder full of signatures I need from you guys in preparation for the bond issuance.
Bond issuance for the highway.
I'm gonna read it.
Like a whole,
I think you just
I
need,
have to read it all. I can't sign it.
no,
I
you
haven't
need to
read.
sign it so you can find out what's in it.
Yeah,
I don't know how government works, do you?
that's how we do it.
so I don't have anything else for you guys.
Just Bill to sign?
Up to you guys. No, like,
I mean, Bill just only has to sign all those?
oh no.
Oh,
All of you, multiple pages per folder.
Any other miscellaneous before we go to that?
I have nothing.
Okay, I have nothing.
nothing here.
Okay,
Done?
we're done.
Okay, let me.
We're
turn this
adjourned.
Just need to sign though, right? You got a bunch of stuff to sign.
Yeah.
Yeah. Off the clock.
All right.